Ankylosing spondylitis. It is derived from word ankylos, which means crooked, curved or rounded, spondylos, which means vertebra, and itis, that is inflammation. So basically it is a chronic inflammatory disease that affects the vertebra. It is also known as AS, spondylitis ankylopetica, rheumatoid spondylitis, and Marie-Strumple disease. It is an inflammatory disease. Even the skeletons with ankylosing spondylitis are found in Egyptian mummies. It affects the joints of axillary spine, that is axillary skeleton, including the skull, ribcage, sternum, and vertebra. The calcification and ossification of ligaments and capsules of joints occur in this disease. Complete bony ankylosis, that is stiffness, occurs. In healthy spine, between two vertebrae, there is intervertebral disc, which got inflamed in ankylosing spondylitis, and ultimately there is fusion of bones, which gives a look like bamboo spine. Etiology. The main cause is idiopathic, that is unknown, hereditary, and in about 90% of cases it is connected with HLA-B27. In normal spine, between these vertebrae is intervertebral disc, which got inflamed along with the ligaments and the joints, and then there will be formation of syndesmophytes, that are bony protuberance at the body of the vertebra. And finally, in advanced stages, the vertebra got fused and gives the look of bamboo spine. There are many diseases which is related to HLA-B27 antigen, and it has a mnemonic PAIR, pair, where P stands for psoriatic arthritis, A for ankylosing spondylitis, I stands for inflammatory bowel disease arthropathy, and R stands for reactive arthritis or Reiter's syndrome. Pathology. The inflammatory reaction with cell infiltration causes erosion of the cartilages of adjacent bone, which then causes replacement of granulation tissue by fibrous tissue, and ultimately ossification of the fibrous tissue, leading to ankylosis of the joint, that is the stiffness of the joint. Clinical features. The onset is gradual. Age is about 15 to 30 years, and it is 10 times more common in males than in females. So basically the patient is a young male. Low back pain or lumbago in early hours of morning, especially after waking from the bed. Later the spine and involved joints become stiff, and ultimately joints become completely immobile. It can't be moved. The joints affected are sacroiliac joint, which is most commonly affected joint, a joint between sacrum and ilium, spine or the vertebral column, costal, including the ribs, especially the joints between the vertebra and the ribs, and the shoulder joint. Due to the flexion of the spine, the patient bends double, he cannot see the front, and the progressive limitation of back motion is present. And ultimately there is increased kyphosis, that is forward movement of the thoracic spine. The costovertebral joints are involved, so there would be restricted chest expansion because these joints are responsible for the breathing. So there will be anoxia and wasting of trunk muscle, that is the muscle of thoracic region and abdominal region. There would be pain over the heels, symphysis pubis, the joint between pubic bone, greater trochanter of femur bone, and iliac crest of hip bone. Atlantoaxial subluxation with spinal cord compression. There is an deviated form of C1 and C2, where atlanto is the atlas C1 and axial is C2, and there would be 3 grades: grade 1, grade 2, grade 3. As the severity will increase, the spinal cord compression will increase. Enthesopathy, that is inflammation of disease of enthesis, where the tendon attaches to the bone, especially the Achilles tendon or tendocalcaneum. Plantar fasciitis, that is inflammation of plantar fascia. Swelling of tendo-achilis at its insertion. It got inflamed. Sausage-shaped swelling of finger or toe. It is also called dactylitis, that is inflammation of finger. Other symptoms are anterior uveitis, that is inflammation of the middle layer of eyeball. Non-specific urethritis, that is non-gonorrheal urethral infection, in which the urethra got inflamed. There are many cardiac symptoms like aortic incompetence or aortic regurgitation, where the blood comes back from the aorta to the left ventricle. There would be atrioventricular and intraventricular conduction defect. The general symptoms would be anorexia, loss of appetite, low-grade fever, weakness, and loss of weight. There are some physical examination like Schober's test, Faber test or Patrick test, Genslin test, and Chin-Brough vertical angle test. In Schober test, the test is used to know the limitation of lumbar movement. A point is marked 5 cm below and 10 cm above the L5, and the patient is allowed to touch his feet, and if the distance doesn't increase more than 5 cm, then Schober's test is positive and the patient may be a sufferer of ankylosing spondylitis. Another test is Faber's test or Patrick test, which detects the joint dysfunction in sacroiliac joint. The patient's leg is flexed at the hip, abducted, and placed in a finger of 4 position. The position will be like a figure 4. Force is applied to the ipsilateral knee, means on the same side of the knee. If it reproduces pain in the ipsilateral sacroiliac joint, the test would be positive. In Genslin's test, the hip joint is flexed maximally on one side and the opposite hip joint is extended, stressing both sacroiliac joints simultaneously. And if there is pain in sacroiliac joint, then it is positive. And the last one is Chin-Brough vertical angle test or CBVA test. It is used to demonstrate kyphotic deformity. Measures the angle between a vertical line and a line connecting the brow to the chin while the patient is standing. And if there is any deviation, any degree greater than 0, the test would be positive. Investigations are blood examination, which is normocytic and normochromic. That is, the number of RBC would be normal and the concentration of hemoglobin will be also normal. High ESR, histocompatibility antigen, that is HLA-B27 will be present in about 90% of cases. Negative serologic tests for rheumatoid arthritis, that is rheumatoid factor. That's why it is also called a seronegative disease, because the rheumatoid factor would be absent in the serum. In X-ray report, the sacroiliac joint show irregularity of the joint margin with sclerosis, that is hardening, narrowing and fusion of vertebrae. Lateral thoracolumbar spine show anterior squaring of the vertebrae. The vertebra would be in a shape of square. MRI. Sacroiliac joint and spinal joints are ossified along with annulus fibrosus, which is a part of intervertebral disc. Anterior and lateral spinal ligaments are also calcified with bony fusion of the spine, giving a look of bamboo spine or tram-track spine. MRI again. Gradually there may be demineralization of the vertebral bodies, sclerosis of annulus fibrosus, that is hardening of the layer of intervertebral disc, causes the shiny corner sign. Another mnemonic for ankylosing spondylitis is 7A, where first A stands for ankylosing spondylitis, another A for arthritis, atlantoaxial subluxation, anterior uveitis, aortic regurgitation, AV conduction defects, and Achilles tendinitis. Thank you for your time.